Ladies and gentlemen, boys and girls and children of all ages, just understand, medicine is show business for ugly people. Okay? Look around. Okay? Keep your day jobs. You know, there are very few people who are actually going to get a job here on stage in Las Vegas. You know, it's just not going to happen. If you think you qualify for Wild Girls or something, let me know. In fact, I've got an opening tonight. But the bottom line is, if you don't believe you're totally in show business, you're an idiot. The actual science knowledge in this audience is actually very small, whether you realize it or not. And anybody who wants to get quizzed on the posterior ventral nucleus of the thalamus, I'm happy to do it. But everybody here, no matter what the complaint, is going to have to make a patient happy in some way, shape, or form. How do I know this? Because I see the other side of unhappiness, which is lawsuits. So what do you have to know to not get sued? What is the key here? Know the medicine. That is, play something called BizBuzz. I can sit down with you and say certain words in a certain order, and you ought to give me what the diagnosis is or the thing you've got to rule out. Oh my God, I'm a 55-year-old man. They operated on my leg last week, and now I'm a little short of breath. What do they have? Of course. The point is, everybody comes in with something playing in their head. They've got a recorder that says, I've got to rule out this disease. When you see a 14-year-old boy brought in by his mother, and he's got tenderness in the right lower quadrant, what does she think he has? Appendicitis. If you don't mention the words about why it isn't, or why at this moment we don't know, they think you are an idiot. Everybody's got these things going on in their heads, and they come in with pre-programmed expectations that you got to meet. Next, know the pitfalls. Let me give you the number one pitfall you have, and I don't care whether you're a PA, NP, physician, that is anchoring bias and pre-arranged prejudice. If I said to you, the next 10 patients you're going to see all have low back pain, how many people here would be happy? Put your hands up. Okay, say, if there are 3 charts on the rack, I've observed this, you know, saw my first patient in an emergency department in 1968 as a freshman medical student at the University of Michigan. Let me tell you that if there are 3 charts on this rack, one of them says 4-inch laceration on the inner thigh of a cheerleader. Okay, that's over here. The next one says allergic to Haldol and beaten up by the police. That's 32. And the third one is weak and dizzy since 1954. All right. All right. We all understand what I'm talking about here. You pick up an internal prejudice when you pick up a chart. Now, I'm a discriminatory guy. I like certain things. I like nice suits. I've got a Conway Stewart pen. I like certain things, but I can't let it interfere with the seeing of the next patient. So some of you have to do this. I promise you this. I had to do it. Stand outside the door and you look at it, it says low back pain. Are they ever properly undressed? No. Let me ask a question. This is how you know if your system is dysfunctional. How many people here have seen a patient in the last 2 months low back pain, who still had their shoes, socks, and pants on? Stick your hand up. Yeah, your system is dysfunctional, which means America is dysfunctional. Okay. It's like trying to explain Las Vegas to somebody. If somebody landed from another planet, they'd conclude there's no intelligent life on this planet. Okay? Oh my God. They actually built what in the middle of the desert? Very hard to say. But it is this internal prejudice before you walk in, and you ought to write down. This is what I have residents do all the time, is write down their hot buttons. There are certain words that piss you off, and you want to fight, okay? Whenever they say, well, doctor, I have a very high pain threshold. I can take anything but this. Now you're mad, okay? And it's always drug people, and by the way, the number of lawsuits that involve drug people is huge, because they have the two things that are going to get you sued. First, you don't like them, and number two, when you don't like somebody, you don't do the job as well. This is show business for ugly people. Act like you care. And you're all going to say, well, that's sort of acting. That's not real high-quality science. Shut up. There's nobody in this place that does I've got all kinds of books about the brain. I say, you know what? I'm not on my way to the Nobel Prize. Get a life. All right? You do act. You act interested when your 5-year-old comes home with a drawing they made, in school, right? You do act interested. No matter what's going on in your life, because to do anything else would be cruel. It would be cruel. Now, I learned over the years. When I started out, I'd say, oh, that's the most interesting horse. And they say, no, it's you, Dad. Okay. I said, well, then it's a horse's ass. Okay. But I learned to say, tell me about it. Right? We learned how to deal with it. You've acted your entire life. There ain't nobody here who hasn't acted in bed, right? Yeah. You're the best, babe. Yeah, right. Send me a message if you haven't, okay? And you're just full of shit. Okay. Avoid being sued. You got to have insurance. Insurance issues come up all the time. It's reasonable to request a copy of the insurance policy. Why would you work for anybody who didn't give you a copy of the policy? You ought to know whether you're covered. I'm going to give you 3 terms, and if you don't know what those 3 terms are, you're deficient in understanding insurance. What's an also named insured? By the way, what type of policy is it? Is it claims made or occurrence? By the way, do they stack the limits in the tail? If you don't know the answer to those questions, you can't actually look at a policy. This is something that requires work, and by the way, you need to protect your financial future. It won't cover, and I've written these policies, I've run 2 insurance companies, we never cover stuff done outside the emergency department. So if you want to volunteer your time, just understand you're doing it without insurance. Ours is based on a chart produced at a location, which we paid the premium on. Have I had lots of cases where emergency docs wanted to do the right thing, right? Just understand, all good deeds are punished by someone. I had a guy who wanted to volunteer at, this was diabetic camp, okay? So one night, and he got something, so you could not consider it Good Samaritan. His wife and family got a cabin at this camp, and they could paddle the canoes and that sort of crap. So one of the kids he sees after dinner has indigestion. By the next morning, they have appendicitis, which ruptured. So now he comes into me and said, well, we got to be prepared for this case. I said, what you mean we, white man? Okay? You do not have coverage here for this little adventure you went on. Ask some real questions here. Grow up. You're in business. If you're not in business, what are you in? I just hate to see emergency physicians put themselves out and get pulled over the coals based on this. By the way, we never cover you for criminal behavior. How many people would actually like to execute some patients? Sure. In fact, somebody said when you graduate from med school, you ought to get 6 platinum bullets with your code number on it. So, and so if you shoot a patient and the pathologist finds a platinum bullet, they put it down as natural causes, the death. Here's the bitch with that. After a week, you're out of bullets, okay? You're just out of bullets. So you've got to practice the rest of your life, figure out how to do it. Never take anything construed as compensation for a Good Samaritan act. Now, since 1837, there's never been a healthcare professional sued for stopping at the scene of an accident in the state of Michigan. It never happened. People always say, well, you could get sued. You can get sued for anything, so do what's right. You know what? No court wants to deal with that sort of thing. Avoid being sued pharmacology issues. There are excellent drugs which have something called a black box warning put around them. That's by the feds. They do it for a reason. Now, not always a good reason. But the point is, you should be aware that it's black boxed. Because if you have to go answer a deposition, and how many people here have ever sat through a deposition? There's a few of you. It's not a pleasant experience, is it? No, they're there to pull every hair out of your nose and shove it down your throat. And you can't believe how smart some of the people are who write these questions. You know, I train attorneys just like I train doctors and PAs and all the rest. I promise you, if you've used a black box drug, you better have a way to defend that, because it doesn't make sense to the rest of the world. Never prescribe to anyone you know personally. Now, I don't care if it's amoxicillin or something, but if it's a registered drug, if the Drug Administration, the DEA, is interested in that drug enough so you have to use your number, you better not have a personal relationship with that patient, and you better have a chart. All of these things kind of flow together. Think about it. You need to make sure you have warned patients about mind-altering drugs. That means any drug that has a DEA number can alter your brain. So, standard warnings given. Don't drive, don't drink, don't make any big decisions. Buy your jelly beans one at a time, sort of stuff. No big expenditures. All those things are important. And last, check for the drug interaction. Just ask the question. You know, stop for 1 second. Emergency people write for, 85% of your scripts are antibiotics and pain medicine. If it's any different than that, you have a different life than I do. And by the way, the smartest docs I know about 25 drugs. If it's not on my list of the 25 I give out, I go back to the book and look it up. Now, I'm old. I use a book. But I'm sure all of you bring it up online or whatever you do. And just understand, that's what everybody expects will be done if you don't give it out every day. What about testing issues? Never order a test you don't know where it's going or what the answer is, and send someone home. I'm an anti-test doctor. I probably get a CT scan in 1 in 200 headaches. Why? Because, heaven forbid, I can actually examine. You know, I'm from the old school. History, physical, very selected testing, and get it right. If you're going to send off a bunch of crap tests, you better make sure somebody knows where that's going. I have all kinds of legal cases where they've ordered something in the emergency department and nobody followed it up. Let's say you get a standard chest x-ray for reasons, let's say they were in an auto accident, I don't know what you're looking for, a pneumo or something. Now, an official reading comes back a day later that says, small nodule left upper lobe, clinical correlation required, the most dangerous words in the world. Who's going to see that? Who's going to make a decision? Lawsuits are based on that, and understand it. Have some way of following up and knowing what happens. By the way, telephone-related issues, we don't do it. We don't give out telephone advice. You know, I've got this rash. What are you going to say? Hold it up to the phone? Aren't you glad they don't have vaginal discharge? The bottom line is, we don't give out phone advice. Thank you. What's the follow-up on that? How do you know it even took place? I've got that case. I've got a case that was seen in the emergency department. 12 hours later, mother called up and said, I don't think my baby is doing as well. And they said, well, double the medicine. I had another case where they said, well, you've got an appointment to see your doctor it's midnight. They'll see him at 9 o'clock in the morning. Does meningitis do well over 9 hours? It didn't in this case. You don't give it out. What you say is this: hi, we're here 24 hours a day, 7 days a week. Come on down. We'll take a look. Because to say anything else is just sort of crazy. You're not that good when they're there. How good are you when they're on the phone? 90% of the diagnoses made in emergency medicine are Gestalt diagnoses. You walk in and look at it and say, oh, Jesus, right? 90% of kids are. You walk in the room, the kid's running around, having a good time, stealing crap out of the drawers and eating the popsicle. Is he going home, yes or no? Yes. Then you walk in and you see that limp child whose eyes are at half staff. Does it take any intelligence or test to know that's a sick kid? No, it doesn't. That's why we look at them, why we don't use the phone. By the way, don't leave HIPAA information on the phone. Sir, I know I'm not speaking to you, but yes, your gonorrhea test is positive. Have I had that one? Yes. Did his wife like it? Not much. Okay? Just don't do it. What about other EMTALA-related issues? Medical screening. Medical screening should only be done by those people who are approved by the board of the hospital to do screening. If you're not approved, don't pretend you're screening. And it not only affects payment, but it can affect, is this an EMTALA case? And you should not discourage people from receiving the screening exam. If on-call physicians refuse to come in, that should, for anyone here who is working as an advanced practice clinician, that's the case that needs to be referred up to the doc in charge of the department at that moment. This needs to be a doc-doc communication. And you have to say things, doctor, how do you spell your name again? Because I want to make sure I have that correct on the chart for when the feds take a look. I just want to make sure the information is correct. And you know what? They come in. Or you have an administrator on call who you call and say, you know, your guy on call here is being kind of a poo-poo. That may be above your pay grade. But make sure there's somebody's pay grade who's going to follow up on this. It's important. What about transfers? Have transfer policies in place. If you don't do something, don't pretend to do something. Don't do it half-time. There's all kinds of hospitals in this country, by the way, that do need to close. There are a lot of things they can't really take care of. You know, some hospitals are okay to die in, but they're not great to live in. And if you don't have certain things, just understand it and get the patients gone. I was talking to some people before this discussion, and they basically said, well, you know, the real problem is not us. It's the doctors. They hold on to people too long. Well, make a decision, because it's either we're going to do it here or they're gone. But there's no in-between here. Well, maybe we'll watch this trauma patient for 2 or 3 hours. No, because if you need an interdiction and you can't do it, what would you do for somebody you actually loved or cared about? You notice I didn't say your spouse. But you want to make sure that you have it set up, that transfer takes place quickly to a reliable place that does it all the time. And follow the hospital transfer protocol to the letter, because someone's going to come back and talk to you. Avoid accessing records that aren't yours and you don't have a reason. Now, in most of your hospitals, this isn't a huge issue, but I'll tell you what, if you're the doctor at Cedars in Los Angeles, Hospital to the Stars, if you call up a record that you're not seeing, automatic dismissal. They had a woman who actually sold Madonna's gonorrhea culture to TMZ or something like that. Got her $50,000 bucks. How long do you think they still lasted? Zero. This is on a need-to-know basis. I was involved in a meeting in California about all these things. We had a gentleman who came in at one hospital who had a light bulb up his rectum. Well, the nurse thought that was a pretty great x-ray. How many people would think that's a pretty interesting x-ray? Yeah, sure, not a problem. You got to remember, when you go to dinner with emergency docs, it's one of the few groups that actually sits around and talks about their favorite rectal foreign bodies. I mean, there's no question. But she took a picture of it. But she only sent it out to her 500 BFFs, one of whom blew up the picture and they could read the guy's name. His wife was informed. He's worth $50 million, of which she wanted half and a little more. You know, understand, the physician involved got sued, the nurse got sued, the hospital got sued. You don't release anything. You don't talk about it. You don't do anything. Now, I know everybody's going to say, well, there is no universal privacy anymore. It is in medicine. So you're not sending anything anywhere except to secured numbers to get an opinion. Now they're having a lot of the consultants, cardiology consultants and that, with certified phones so that they can look at that EKG and it ain't going anywhere else. This is what you do. This is what you need. Do not give any patient-related information to anyone without permission, and do not even think about posting pictures to your phone. It's fireable offense in most hospitals these days. Be careful about the writing of orders. You shouldn't be writing other people's orders. If they're getting admitted to medicine, medicine ought to write the orders. Orthopedics ought to write the orders if they could figure out how to write, you know. It's always nice, you know. You can always tell when ortho comes down because their knuckles drag and they're, you know, kind of in there showing the picture. They say, fracture. Yes, Gonzo, fracture. Okay. They say, you write orders? I say, no, Gonzo, you write orders. You all know the difference between a carpenter and an orthopedic surgeon? Yeah, carpenter can name more than one antibiotic. That's very important. Let's see here. We'll do a little more. Time is running out. No derogatory comments on the chart. You don't want that crap read to the jury. Never use the term drunk. They may be inebriated. They may be disheveled. But I actually had a chart that said dirtball drunk on it. Well, you know, he after 4 hours, his alcohol should have been gone. And now the only reason he was talking funny was his subdural. Do you want that chart read in court? I've had all kinds of these things. I had one guy who, we'll tell the story. It actually said on the chart, a 26-year-old black male SPOS, S-P-H-O-S. A nurse wrote this. Now there's a lawsuit going on, which has almost nothing to do with her evaluation, but it's in Wayne County, that's Detroit's county. And they asked the nurse on the stand, who's sort of a fat 45-year-old white woman, what did that comment mean? And she said, well, that was just a name we had for people around there. He said, what does SPOS stand for? And she told the truth. She said, subhuman piece of shit. She said it. Well, there's a pretty ethnic jury that wants to go over that jury box and beat the crap out of her. That case was settled in the hallway for a lot of money based on what was going to happen because of a rude comment. Don't do it. It's just not worth it. Negative statements are not useful. Don't do it. If the patient has used, let's say, particularly scandalous language, which someone like me would never use, put quotation marks around it. You can do that because that's a fact. That's a fact situation. But be very careful of using prejudicial materials. I'm only going to cover one other issue because our time is running out quickly, but I want to talk about against medical advice. It's going to happen all the time. The problem in emergency medicine is not about consent. Of my 2,400 cases, I've never reviewed a consent case. It's informed refusal, because there is a standard for informed refusal. Now, I know you've been led to believe, well, just have them sign this piece of paper. That doesn't work, folks. That doesn't work. Here's the 5-part standard. You will do this the rest of your career. If you don't do this, I'll give you a card when we're done. By the way, we're always happy to talk to you. The faculty is happy to talk to anybody. But if you don't do this, you will be a defendant physician or PA or whatever your role is at that moment. You will be there. Here's the point. Number 1, adult years. This is the Schollendorf decision. Justice Cardozo. Those of adult years and sound mind. And this decision came down in the court system, New York, Supreme Court, 1914. We've run medicine with this decision since 1914. So we're celebrating the 100th year. Adult years and sound mind may decide their own health care. So an 11-year-old who's bitching, pissing, and moaning, do they get to decide what happens? No, they don't. You know, just do what you got to do. Screaming kids, not a problem. You know, I had plenty of them. And you have to do what you got to do. Now, sound mind, what does that mean? If they've got slurred speech and unsteady gait, do they have sound mind? By definition. No, they don't. And sometimes we do have to strap people down. But here's the question. Do I have adequate grounds on which to suspend civil liberties? Now, one of the places I worked, we'd have 5 people strapped down a night. And they all said the same thing in the morning. Dr. Henry, was I bad again? Yes, Ralph, you were bad again. Well, sorry about that. I'll see you next weekend. Okay, Ralph, we'll see you. How many people have regulars like that? Yeah, of course we do. Understand you are your brother's keeper when they lack sound judgment. It'd be very clear. Third, you've told them the alternative. So I get perfectly reasonable people who don't want to go through with what I say. I've told them, here are the alternatives. Number 2, I told them, you could die. I never use euphemisms with patients. I don't know what they mean. I always love one of my partners used to say, you might have an unfortunate outcome. What the hell does that mean? I like dead. You know, all of us understand dead as a concept. So tell them that. And lastly, I want their family in there. I want the family to sign that they heard the discussion. And it's always the same thing. If the family gets involved, you win 98% of the time. Why did they bring Grandma? To get her what? Admitted. You all are familiar with the positive suitcase sign, right? There's a small suitcase. They thought you were going to admit Grandma. You want to admit Grandma, and Grandma's saying, I don't want to come in, right? Pneumonia isn't that bad. I've got cats at home. Cats? No, I like cats. Parboiled, French fried. But you know what? If you get the family involved, they solve 98%, and they're the people who are going to sign off and say, you're right, you tried, doctor. You did everything reasonable you could to get this patient in. When you've done all 5 parts of this examination, I've never seen anyone lose the case. Never lost one. Now, there were some suits, but you know what? They almost always go away during deposition phase because we talk about this issue. And I've defended docs everywhere on this. We never lose one of those cases if all 5 parts are down. If you have a patient not doing what you want them to do, grab the supervising physician, haul them in. This is another one of those areas where you want all the muscle on your side you can, because you want it very clear what happened, what you did, what you wanted, and who this is going to affect. All right, ladies and gentlemen, we've run out of our time. I'm smart enough to know you should never get in the way of healthcare people and a break. You have a break now for the next 15 minutes. Thank you very much.